Yes, Guyana to the world.
Globespan is a Guyanese dialogue moving towards the realization of one nation in one Guyana. It's a platform that offers an all-inclusive discussion with the pros, the cons, the ones that is taken aside, and the ones that stand in the middle. Globespan believes agreeing and disagreeing are part of the nation's building.
She is a beauty, beautiful Guyana, with wonderful people all over this country.
Globespan believes every Guyanese voice is part of the nation's building. As we span the globe for voices from the diaspora and those living home, we stand on our commitment that we are all Guyanese working towards one nation in one Guyana. As the world turns on its axis bringing changes, we as Guyanese must adapt to those changes for a better Guyana for all. Globespan stands on its axis with its belief that one nation, one Guyana, one destiny must include voices from all corners of Guyana.
With many flavors, 6 different people blended together. Raise your flag high in unity, we're family with one destiny. Raise your flag high in unity.
Good evening, everyone, and welcome to Globespan Television here in New York. I'm Dr. Asquith Rose, and I have with my 2 guests tonight, Dr. Keith Cummings and Dr. Emmanuel Cummings. We will discuss all sorts of issues concerning cancer, obesity, diabetes, and heart disease, etc., etc. But before we get there, I just want to let all our listeners know that this program is being made available by Mr. Noir Singh, and our technical directors, Mr. Devin Bissoon and Mr. Ryan Gobin. We are a fair and balanced network. And whatever we discuss here, we listen to all the views and we don't make a judgment call on any one of them. Our listeners, you or viewers, you make the judgment call yourself. We can be heard on Facebook and YouTube and many other social networks. So tune in there and you'll be able to pick us up. The views expressed tonight by our guests are solely theirs and not those and does not reflect those of Globespan, the staff and management of Globespan Television. So please join us tonight. It's a very educational program. It's based on health issues, which is very, very important for all Guyanese and for everyone listening across the Caribbean, the United States, and around the world. Thank you very much. We have with our guest here, Dr. Keith Cummings. Dr. Cummings is a physician, a family physician in New York here, and he's an associate professor as well, lecturing on health issues. Dr. Cummings, welcome to the program.
Oh, thank you very much, Dr. Rose.
Since you're new in our program, I know you're Guyanese as well, and I know you got a lot of awards. The last award you got was the Presidential Lifetime Award, but you received many congressional awards as well. But can you give us a background of yourself?
Okay, so I'm Guyanese. I'm from Brighton Village Quarantine, and I grew up there, went to Central Quarantine Secondary School, previously called Bushlat Secondary School.
Okay.
Then subsequently, I did pharmacy in Guyana, University of Guyana, then migrated to St. Kitts and Nevis and back to Guyana, did medicine. And from there, went to Grenada, got married to my beautiful wife there. And subsequently, both migrated to New York. And I've been in New York for most of my training, and subsequently went to University of Alabama. And I've been an assistant professor of medicine at Emory University in Atlanta. My wife and family, kids, 2 boys, are still in Georgia. My wife is pursuing her PhD in molecular laboratory science.
Wow.
But I moved to New York, where I love the New York lifestyle. So they will subsequently join me next year here after she finishes her PhD in laboratory science.
Good, very good news. Very, very good news. Now, you're a family physician. Tell me what areas you practice.
So I also practice internal medicine and family medicine. My areas focus primarily in hospitalized patients So I really don't see patient outside of the hospital. It gives me a balanced life to allow me to travel and involve in many voluntary initiatives. I travel to in the Caribbean. I go to Jamaica a lot with the Jaja Foundation. It's called Jamaicans Abroad Helping Jamaicans at Home, but I'm Guyanese. But
Okay.
they have a very rigorous program. We do a lot of work in Jamaica, big work. They influence a lot of outcomes in Jamaica. In New York, I'm involved in a lot of non-fund charitable organizations. I help a lot of Guyanese, Caribbean nationals. I look out for a lot of Caribbean nationals, especially people who don't have insurance and need health advice and care. I do a lot of consultancy. Everything is pro bono, free. Basically, giving back. And that's why I'm involved. Anytime I go to Guyana, I find myself doing lectures, either in Berbice or Georgetown or Linden. I always walk with a flash drive to give back the guys something, because that's the only way we can help in some measure, rather than make critical comments without contribution. And
Okay. Go ahead.
al-
Go ahead.
I've also been involved in donations a lot to many churches in Guyana, and also Linden Hospital. We have done a lot of donations there, and also some private hospitals. I've been involved in a lot of donations. Yeah.
Great. Good news. Congratulations. Now, I want to talk to you first about diabetes, which is a chronic disease, but is affecting a number of Guyanese at home. And from my understanding, diabetes occurs when the human body does not produce enough insulin. And this could result in high blood levels. Explain to our listeners what causes the body not to produce enough insulin.
Okay, so diabetes is a syndrome, and the main thing is insufficient insulin, or you have enough insulin, but it's not enough to meet your metabolic demands in terms of handling sugar. So some people born like that, so it's genetic, they acquire this from their parents, and so they don't have enough insulin. So we usually broadly say it's type 1 diabetes, but majority of the people, over a period of time, your body has enough insulin, or just don't have enough, or you do have enough, but it's when it go to the site to work, to your muscles, your liver and other tissues, you have a lot of resistance to the insulin. So we call it insulin resistance. So in nutshell, is a disorder of sugar and also fats and proteins. So because your cells need sugar, and if the sugar cannot get in the cell because you have insulin or not enough, or you have enough but it's impaired in the way it's acting, not net results, sugar can get in your cells to produce energy. So what actually happens, the sugar is built up in your blood. And when it builds up in your blood, it causes a lot of damage to a lot of hormones, your nerves, it damages your eyes, it damages your blood vessels, it coats your blood vessels and cause you to have heart attacks, lost your sight, lost your limbs and blood vessels. And kidney, of course, a lot of people lose their kidneys as a result of that.
So diabetes could be a devastating disease to the human body. Okay, now there are type 1 and type 2 diabetes. What is type 1 diabetes and what is type 2 diabetes?
So type 1 is you're born with it, technically, and you basically can't produce enough at birth. And over time, as you grow older, your body needs to utilize the glucose that comes in from your food or your liver produces, but you can't handle it. So type 2, many people have type 2. And it's usually adult onset diabetes. We call it, as you get older, you become sick and frailer, and somehow you may have a nasty infection that throws your body in a state that you may not have enough, but you have some insulin there, opposed to type 1. Type 1 doesn't have insulin, little or none at all, whereas type 2 have enough or not enough, but there is insulin. So because of that, whenever they're sick, they got pneumonia, blood infections, or any minor infections, they can't handle the infection because the sugar is too much in the blood vessels, and it causes them to have poor response to infection, as well as the buildup of the sugar now coats or caramelizes their nerves, the blood vessels, and so particularly the eyes and the nerves in your legs and also your kidney. They coat the kidney tubules so much that your kidney stop working, and many people end up with kidney failure. So that's a big thing for Guyana now, and it's good that they have dialysis now in Guyana, which is not the ideal thing, right? But when I was a medical student in Guyana, most people who have end-stage damage to the kidney because of complication of diabetes were dead. I could tell you, being a student, I used to be above the mortuary studying as a third-year medical student, and most people, you have kidney damage. There was no dialysis at the time when I was studying here. Uh,
Okay. Dr. Emmanuel Cummings, welcome to the program.
Thank you. Good evening to you, Dr. Cummings, and to all viewers out there. Thank you.
Let me ask you the question. Is by no means that the two of you are related?
All Cummings are related.
All Cummings are related. Okay, I like that. Now, before Dr. Cummings just joined us, and let me say this. Dr. Cummings was here before, I think it was last year sometime. He is the former Dean of Health Science, Professor of Molecular Medicine, and Deputy Vice Chancellor, Academic Engagement at the University of Guyana. Now, Dr. Emmanuel Cummings, let me ask you first and foremost, explain to our listeners, first of all, welcome to the program. Explain to our listeners, what is molecular medicine?
Well, molecular medicine is trying to understand the molecular medicine, the chemistry of life, and to understand medicine at the molecular level, the origin of diseases. And once you have an understanding of the origin of diseases, it'll be a better way to understand the treatment, because everything happens at the molecular level. That's at the biochemical level. That's where life occurs. That's where all our life is taking place, cellular life, which involves a series of chemical reactions. And so that's what we study. We understand that. And so once we understand that, we'll be able to have a greater understanding as how to treat diseases, because that's where we treat disease, because disease originates there and also treated there.
So I guess a lot of students are interested in molecular, in your teachings at UG.
Well, I do teach that in the first year, right? First year medicine for years. Yes.
Okay. Just let Dr. Keith Cummings complete the diabetes, and then I'll get to you. We'll talk about cancer, which is affecting Guyanese very, very badly. As a matter of fact, I read somewhere where in the past 6 months, cancer is increasing Guyana by almost 20%. But the rate is still lower than most of the Caribbean countries from what I gather as well. But Dr. Keith Cummings, let me go back to you. Type 2 diabetes, explain that.
so as I said earlier, the type 2 is more found in adults. They usually have insulin, but their utilization of insulin to drive the sugar in the cell is impaired, or they just don't have enough, but they have some. Type 1, you don't have, basically, you don't have no insulin. As a result of that, you have too much sugar in your blood, and you need sugar to generate energy. So what the body does, the body begins to utilize other forms of to get nutrients to get sugar. So it begins to break your flesh, your proteins, your muscle begin to break down. You also begin to break down fat. And this is not a good state to maintain your body, because they're not the ideal form of nutrients to maintain good life and function. So type 2 diabetes, because of that, the excess sugar, it coats your nerves, damage your eyes, damage your kidney, damage your feet, and as a result, they end up with amputation, blindness, increases the heart attack. So diabetes is considered coronary artery disease equivalent, meaning it's like a small attack. So one of the leading causes of death in Guyana, more than cancer, is ischemic heart disease, meaning that they have coating of the blood vessel in the heart, and this blood vessel is not allowing blood to go to the heart itself. which is one generated in the blood. So the leading cause of death in Guyana is still heart disease, and the one is ischemic. And diabetes is one of the major contributors to heart attacks and brain attacks and leg amputation.
Good. Now, let me just ask you one more question on this here before I get to Dr. Emmanuel Cummings. What is monogenic diabetes?
Monogenic. I haven't heard the term monogenic. Maybe
Monogenic is monogenic, I think. You have more that term?
No, I'm not familiar. There may be many terms that you use in the past, but because things are changing rapidly, I'm not familiar with the term monogenic. Emmanuel, maybe you can pronounce a monogenic diabetes.
Dr. Emmanuel.
Since he's into molecular medicine.
We lost him. Devin? Devin? Brian?
Yes, sir. Yes,
We lost Dr. Emmanuel Cummings.
Yeah, we lost him for a second.
Okay.
But there are different subclassifications of diabetes, and there's terms. For example, in New York, we talk about flatbush diabetes. And Flatbush is an area in Brooklyn.
Brooklyn, yeah.
Where there's a predominance of Caribbean population, and the researchers at that time had found that a lot of Caribbean people come in with the downstate university hospital with diabetes, and they tend to behave like type 1 diabetes. When they're under stress, they have infection, they undergo surgery, they behave like a type 1, so they end up with a complication we call DKA, diabetic ketoacidosis. So they call it flatbush diabetes. Then there are other forms of diabetes, we call them maturity onset in the young, where there is type 2 diabetes that is in a young person. You may have a 16-year-old supposed to have type 1 diabetes, mean total absence of insulin or near total absence, but they behaving like they have type 2, so it's a maturity onset in the young. So they are maturity onset type 1, type 2. So there are a lot of different sub-classification, but broadly, now people are just, most of the guys who are treating diabetes are just breaking it down into 2 diabetes. Insulin dependent or insulin non-dependent. Makes it easy for everybody. Is either you're dependent on insulin or you don't need insulin.
But you take insulin when you reach like the stage 2.
No, you take insulin if the sugar is, if there's something called hemoglobin A1C, which was, I think they're getting used to it in Guyana now. When I was there 3 years ago, they had started, but they don't have enough, and there was, it's not very commonly used, which is a great indicator. And if your A1C, which is a measure of how long your cells are coated with sugar for over 3 months, 120 days, is the best marker for how bad your diabetes is, with its control now. That number is supposed to be less than 5.7 if you don't have diabetes, but if you do have diabetes, you want to target it less than 6.5. And if you really have diabetes and you're in mid-age, you want to be less than 7. So less than 7 is the target. If you have advanced cardiac disease, they don't want your sugar to drop too low, because if your sugar is too low, you can end up in a coma. So they targeted a higher number, like 8. But the ideal thing, if you have established diabetes, is to target to less than 7 to 6.5. So that is the greatest. Measuring your sugar, I guess when way back, they used to just measure your sugar level. It's not a good metrics to tell you how bad your diabetes is. What they're doing is looking at hemoglobin A1C, which is how long the red blood cell is coated with this sugar over a 3-month period. If it's greater than 6.5 to 7, it's a bad idea. You need to target. Now, when to use insulin? The patient end up with a lot of end organ damage to your eyes on the get-go. You find a patient comes into your Portland hospital and they already have end organ damage to your nerves in your leg, damage to your eyes, heart attack. You need to start insulin immediately, because the main aim of treatment of diabetes is not to lower the sugar, which some people get mixed up with. Again, the main focus of treating diabetes is not to lower the sugar. The main aim is to prevent end organ damage, damage to your eyes, damage to your brain, damage to your heart, damage to the blood vessels in your body, and damage to your leg, a loss of these organs. So if your A1C is greater than 9, you need to start insulin.
Now, the question I want to ask you is this, and it came from one of our listeners. Someone diagnosed with diabetes, they take all the treatment. Is it a lifelong disease or you can get rid of it?
If the main reason why you're diabetic, especially type 2, we said type 1, you're born with this thing. Type 2, you acquired because you had a bad injury to your pancreas, you have an infection that knocked your pancreas out partly, or you had some bad disease that pushed you into diabetes over a period of time. Or some people have a genetic tendency, their parents have diabetes, and somehow over as they get older and over this, you find that you can't handle the sugar in your blood. If that is true, most of them have to use diabetic medication for the rest of their life. If you're very obese and you have something called metabolic syndrome, you can get rid of diabetes. So their population of 20 to 25 to 30% of people can get rid of diabetes like that by changing their lifestyle. Increased activity means you need at least 30 minutes of intense or moderate activity per week. Minimum, that means you're inactive if you have less than that, but preferably minimum 3 times a week, preferably 5 times a week. Therefore, yes, there's some group of people, for example, Al Roker, the TV announcer, right? He had diabetes and he lost weight, did some bariatric surgery, and his diabetes was gone.
Wow.
There's the mayor of New York, Eric Adams, is a good example. And that's why he's driving the plant-based diet in many New York schools.
Okay.
And not only he had diabetes and got rid of the diabetes, his mother had diabetes. And he was able to get her off the diabetic medication, particularly metformin. So yes, you can get rid of diabetes based on changing your lifestyle, but you should be monitored by a qualified physician.
Okay, that's good news. Now, I'll come back to diabetes just now. Okay, let me ask you this question. Is diabetes more prevalent in males or females, or both, or is it the same?
What's the statistics there, Emmanuel, in Guyana?
It's more common in women.
Yeah, so in the same year.
Studies that was published in 2012.
Right.
It's more prevalent in women and region 3. This one work we published that seems to be there among the very high in region 3. More prevalent in women.
Yeah.
Okay.
So it's the same statistics here as well. And it has to do with several factors, hormonal maybe, genetics, female, and the regulation of glucose metabolism, how you break down glucose. Females do it slower than males. Maybe genetically, in ancient time, men were out there more active, hunting and gathering. And maybe that genetic expression has passed down over time. Women were at home taking care of the family. There's a lot of theories and explanation.
Okay, Dr. Emmanuel, glad to have you back. Now, I'm going to ask you this silly question, but our listeners want to know, what is cancer?
Well, cancer is a genetic disease. You know, that's the first thing. It's a genetic disease that is influenced by the environment. That's the simplest way. It means that if we get a bit more technical now, we're all made up of genes, 23 pairs of chromosomes in each cell. The molecular component of that is our DNA. And so you have some changes in our DNA. There's a big word we call mutation. Mutations in our genes, which predispose us to, which influences the changes, the cellular changes. But these are due to environmental factors. environmental factors do contribute to these genetic changes. As we say, it's genetic loads the gun, but lifestyle pulls the trigger. So we're all, and so there's a set of genes referred to as pro-oncogenes. We all have pro-oncogenes, you know, but these pro-oncogenes are being prevented to be converted to an oncogene by tumor suppressor genes. We have another set of genes that we call tumor suppressor genes that prevents the pro-oncogene from becoming an oncogene. An oncogene is a cancer-forming gene. Now, the environmental factors is what can cause changes in the ability of the tumor suppressor genes to prevent the pro-oncogene from becoming an oncogene. Lifestyle factors. I think that's a mouthful.
Okay. I just want our listeners to know that I'm having a lot of questions from you all, and I'm willing to, but I can't ask all these questions because it will take a year to get my guests off the air. So just bear with me on that. I got 29 questions, so people are interested in this here. Now, one of the questions one of the listeners asked Dr. Emmanuel is, what are the different types of cancer? Can you tell us the different types of cancer? Which is a good question.
Well, you know, from a layman perspective, you know, you can classify cancer histologically, but I don't think that's what the layman wants to know about. There's different types. For example, cancer of the lung, cancer of the prostate, the breast, the cervix, gastrointestinal, right? That's the most common. Now, the world statistics show that lung cancer is the most common type of cancer, lung. And then you have breast, cancer of the breast, prostate, cancer of the prostate, very common in the Caribbean. And then we have gastrointestinal, which is cancer of the stomach, of the colon, cancer of the pancreas. And then you have the liver. So those are the most common type of cancer. There are many other types, but those are the most common ones that you have.
Okay. Breast cancer. It's common among women because women have breasts. But before we get to the detail of that, one of the listeners is asking me, can men also have breast cancer?
Yes, gynecomastia, right? You can have enlargement of the male breast, right? Gynecomastia, right? You can have but it's more common in female, but you can also have cancer, enlargement of the male breast as well.
They say that prostate cancer is very, very common among Black men. Why is this?
Well, you know, that's a myth, you know, but cancer affects all men, right? All men. But it's more one of the reasons why, and one of the reasons why it's more common in Black men and Black people is that, you know, vitamin D, which that's some of the, you know, vitamin D is now a super vitamin D. And when do we get vitamin D? From the sun. Now, because you're dark, melanin, right? It prevents you from getting as much vitamin D than person of lighter complexion. And so that's what the studies are showing from a molecular standpoint as to why Black men are more susceptible, because they're not able to get as much vitamin D from the sun because of the dark, because of melanin. And so Black men should spend longer time in the sun as compared to the other races, because it's linked to vitamin D. Vitamin D deficiency is linked to a lot of things, but that is the explanation that is given. Even and because even breast cancer is also linked to vitamin D deficiency.
Another question I ask you, I will not be able to ask you all questions from the listeners are asking these questions. What are the early signs of prostate cancer?
Well, frequent urination, you know, and first you will have enlargement of the prostate, right? Enlargement of the prostate, and what men would find, you have issues with erection, and then you have frequent uncontrolled, be able, you know, you go into the bathroom very, very often, uncontrollable, where it's very difficult to keep in your that urgency, you know, that urgency to urinate. And so what you would recommend is that men go and have a PSA done or have a digital examination, and of course the urologist will be able to um, do a digital examination and find if there's some amount of enlargement.
What
But
is
those
the
are,
what is the acceptable PSA count?
well, it depends on age. Less than one, but as you get older, for example, men, or let's say in their 50s and 60s, yeah, a score of less than four, that is one that is acceptable. Over that, five, six, seven, enlarged prostate, that is indicative of risk of developing prostate
Cancer.
cancer.
Okay. And
But enlarged prostate is not prostate cancer, right? Enlarged prostate is not prostate cancer, but an enlarged, you can have, if a prostate is enlarged and is not treated, it is not, there is no intervention earlier, it can eventually lead to prostate cancer.
well, I'll just come to that. What are the treatments?
Well, there is surgical treatment, there's surgical treatment, and there's also pharmacological and nutritional treatment. But let me just explain this. I think this might be useful for before we get to the treatment of itself. And to say, Dr. Keith spoke about heart disease, cancer, and everything else. What studies are showing that the underlying condition is inflammation. Inflammation. Inflammation is the origin of all chronic diseases, be it cardiovascular, be it cancer, be it heart disease, obesity. They're all due to inflammation. And so prostatitis is indicative of prostate cancer. Gastritis, H. pylori infection, you're susceptible to cancer of the stomach, so infections. And so I have to say that because we've been talking to the public, and what we want the public to understand, there is nutritional intervention that can reduce inflammation. Before we get to the stage, and so the hope is that no person should get to the stage of an enlarged prostate. And so early dietary intervention, exercise, you exercise can reduce the risk of having an enlarged prostate, and also consuming lots of studies that are coming out now that are showing that foods, nutritional intervention that can reduce inflammation. And once we can suppress inflammation, we can reduce the risk of all types of cancer, not just prostate cancer. We can also reduce the risk of heart disease in general, all chronic disease, once we can suppress inflammation. Obesity. Now, obesity itself is a consequence of inflammation. And being obese, that is a risk factor. So I think what we should be telling the public is exercise. There's a lot of omega-3 fatty acids. The fish diet, which is rich in the omega-3. The monounsaturated, foods that are rich in, the olive oil and all its variants, that are rich in the monounsaturated fatty acids. These tend to have anti-inflammatory action, and therefore that can suppress the enlargement. I think what once you got to the stage of cancer and prostate cancer, there is chemotherapy which is available. But I think what we want is the public to have prevention strategies, develop the type of lifestyle practices that will prevent, though you don't get to the stage of having an enlarged prostate. And so from an early stage, now we usually will tell men, over 40, do get your PSA done to check for an enlarged prostate. But as I said earlier, that cancer is a genetic disease. It means that before you develop a large prostate that will lead to prostate cancer, there's some genetic changes, there's some molecular changes that will have taken place. And so when you're looking for an increase in PSA or an enlarged prostate at age 40, the mechanism for that would have started 10 or 15 years before that as a result of that mutation. And so what happens in the developed world now, they're looking at genetic testing where you can test for the mutation of the gene. And that's long before you have an increased levels of PSA, or long before you even have an enlarged prostate, where you would have experienced mutation in the gene. And so let's say at age 25 or 30, you were to do genetic testing, and it shows that you have mutation, you can have an intervention then. And I think that's where the developed world is going, because when you look at the statistics, all types of cancer, breast, prostate, and you'll see that there is no difference between morbidity rates. The rates you see in prostate cancer in men in the developed world and in the Caribbean, it's not much difference. But when it comes to mortality, there's a huge difference, because in the developed world, there's genetic testing, there's early intervention, early diagnosis. And so with early diagnosis, you can have better outcome. I think that's the way I would want to put it.
Dr. Keith, you can weigh in if you want to know. You can, if so be it.
No, I think Professor Emmanuel is doing a good job.
I know. Dr. Emmanuel, let me ask you this other question on cancer before I get to Dr. Keith. Cancer has been on the rise. Diabetes has been on the rise. Also, obesity has been on the rise in Guyana. But cancer has been on the rise for the past 6 months by 20%. The current cancer rate in Guyana is 142 per 100,000 persons. It sounded a bit high, but I think in Trinidad it's higher, in Jamaica it's higher, and so forth. But based on their population, I don't think they're higher. I think Trinidad is 159, but it has 1.5 million people. We got less than half of 1.5 million people. So I guess so. But my question to you is this: how can this rate be reduced in Guyana? By proactively. Oh, Dr. Emmanuel is gone again? Wow. I guess he's having internet problems. Dr. Emmanuel, are you there? Devin, we lost him again.
Yes, he having some technical issues with his internet.
Okay. Now let me turn to you, Dr. Keith Cummings. Obesity is also a chronic disease. And I say that's when the body has too much fat or excessive fat. My first question to you before I go to the second half of the question: how does one body develops too much fat or excessive fat?
Okay, so you can develop excessive fat genetically. Some people are just born with the genes from their parents, grandparents, that predisposes them to be a little more chubby than others. And if there's a special number that we use called the BMI, body mass index.
Yeah.
Consider you to be obese if it's greater than 30. All right. So you should be less than 18 ideally. But if it's greater than 30, you're way off the scale. But it's a good measure. But some people, various race group are a little more chubbier than another. The Caucasian age groups are slimmer. So people may argue that's not a good metrics to measure everybody across the board, because a guy might be looking slim in one population or culture, or thick or slim thick, and is considered normal. And if he loses weight, you may say, well, that guy has some bad disease. So what they suggest that you measure the mean lean body mass, your actual fat or muscle, and there are different technologies to do that to get a better estimate. So true estimate. But the BMI is a reasonable but not accurate means of measuring your obesity, but it's reasonable. So the other thing, apart from genetically predisposed to gain this excess fat, is your diet. The big thing in all disease is your diet, regardless of the type, whether acquired or genetic. You can influence the outcome by changing your diet. And so if you don't eat enough vegetables, greens, nuts, and grains to feed your gut microbiome, which is everybody's gut has a certain amount of bacteria. They're good bacteria. And so like you have a forest. If you don't feed them with the right food, the forest will not grow. And it then predisposes you to a lot of disease such as weight gain. So if you measure the amount of fat that is covering the organs in the abdomen, that is a true measure of your degree of excess fat. But of course, nobody's going to stick a probe in your abdomen. But you can measure the thickness of the abdominal wall by a graph test. And so obesity has a lot of implications for your health outcomes. It increases your risk of cancer, and it also increases the risk of cardiac disease, worsen your risk of diabetes, and also arthritis, increased risk of mental related disorders, a sense of pride, and a sense of feeling fit. So it has a lot of spin-off, negative spin-off if your BMI is greater than 30. So you can genetically acquire it because of your genes, but most importantly, you acquire it based on your location and your diet. So you can change your outcome because, as I said earlier, the leading cause of death in America is heart disease. The leading cause of death in Guyana and the Caribbean is heart disease, particularly in Guyana is ischemic heart disease, meaning the blood flow to the heart muscles impaired, followed by stroke is the second leading cause. And the third leading cause of death in Guyana is diabetes, based on the POWO data. And then number 4 is hypertensive heart disease, damage to your muscles of the heart through prolonged uncontrolled hypertension. So more obese you are, or more overweight you are, your heart has to pump harder to drive blood across and to supply your vital organs. So obesity has a very bad outcome in general.
So you're saying if your BMI is over 30, one is obese, but one could, instead you could be fat. Well, let me rephrase that. You could be overweight, but don't have fat. Is that true?
Yes, that's true. Some people have more muscle mass. So the argument, and they're right, we use it, everybody that comes in the clinic in Guyana or elsewhere, we use the BMI. But if you look at somebody's structure, say sometimes have a big, it's a height versus weight, the BMI. So it may not be accurate for some people. It's based on the lean body mass, or actually the fat, the muscle content itself. And so it's a guesstimate that is commonly used, but it's not accurate. And you're right, can wrongly categorize some people as obese and label people.
So if people exercise, could they get rid of your obesity and the fat?
Yes, exercise, and it also depends on the intensity of the exercise. You need to have a moderate, they said moderate intensity exercise is the gold standard by public health. Meaning you must have at least 30 minutes of sustained increase in your heart rate.
Per day or day per week?
Preferably 5 times per week, but minimum of 3 times per week. And you're considered inactive if you have less than 30 minutes of moderate intensity exercise per week. That's per week. But you ideally you have best is 5 times a week, minimum of 3 times per week, and you can literally change your BMI, your amount of fat in your body, and also in your abdomen and as well. So you can change your obesity status with increase your activity and changing your diet. We must emphasize that diet, and also decrease the major cause of death across the world, which is cardiovascular disease.
Well, oh, Dr. Cummings, you're back. Oh my gosh, you're having
Yes.
internet problems, am I right?
I move closer to the source.
Okay, okay. Since we're talking about obesity here. Now, the other question I want to ask you, who are more likely to become obese, male or females? And at what age?
Females. Females again.
Dr.
Again,
Cummings, Dr. Emmanuel can weigh in if you want. And at what age people tend to become obese? From small, 10 years, 15 years, 40 years?
Well, you know, let me explain. What the statistics are showing is that malnourished babies, you know, underweight babies,
Yes.
we tend to overfeed them, and that's laying the foundation for obesity. So they're born, you know, they're born underweight, and because we overfeed them, and so childhood obesity is linked to adult obesity.
Correct.
Now, you know, when we speak about obesity and diabetes, they're, you know, diabetes, Dr. Keith spoke about insulin, which was discovered in 1921,
Okay.
and leptin, that was discovered in 1994 at Rockefeller. Now, insulin is a hormone that is associated with diabetes, insulin deficiency or lack of insulin action,
Mm-hmm.
and leptin, that's the hormone that is associated with obesity. So obesity can have several, you can be genetic causes of, there's certain genetic conditions that can predispose you to obesity. The environmental factors, and also the hormonal factor, and leptin, and that's in trying to understand obesity. A lot of discussion is placed on leptin. Now, leptin, that's a hormone that is located in the subcutaneous tissue. And the role of this hormone is to, when you feel hungry, it tells the hypothalamus, look, Dr. Rose is hungry. But now he's filled. So leptin is supposed to, there's another hormone called ghrelin that goes to your hypothalamus and say, Dr. Rose is hungry. And when Dr. Rose is satisfied, leptin will say, well, look, let me tell the hypothalamus for Dr. Rose to stop eating. But like in diabetes, when there's insulin resistance, in obesity, there's leptin resistance. Failure of insulin to respond to glucose uptake that results in glucose remaining in the high levels in the blood. In this case, there's leptin resistance, where leptin fails to tell the hypothalamus, the control the appetite center, that Dr. Rose is filled, and so Dr. Rose will continue to eat. Right? And so there's a hormonal influence. So obesity is something which that is the underlying mechanism of obesity. But also, we must look at obesity as you grow, as you age. What you see is redistribution of your body fat. Your body fat moves from your subcutaneous tissue, from your arm and your leg to your abdominal cavity. That's you see as you get older, you see develop a big belly, right?
Right.
A big tummy, right? And that is redistribution of your body fat. So you have central obesity. And so a lot of factors contribute to that: lack of exercise, poor diet, nutritional vitamin deficiencies, because a lot of studies are now showing that older folks that develop obesity is because of deficiency in certain micronutrients, which is not part of their diet, and lack of exercise. And so you have central obesity. And I'm saying this in the context that we have a way of measuring obesity, a thing called BMI, your body mass index, whereas your height in centimeters divided by your weight in kilogram divided by your height in centimeters square, that is no longer used because that gives you a false sense of security, your BMI. The thing now is body fat redistribution. Where is the body fat? The body fat is now around your heart, around your liver, around your kidneys, and around your abdominal cavity. And that is the danger of obesity because when this body fat is found is located in your subcutaneous tissue, it is fine. It is not associated with inflammation. But when this body fat now moves to your abdominal cavity, it is prone to inflammation. And that's why obese people develop diabetes. They develop insulin resistance because of inflammation. And therefore, all those cardiovascular disorders that are associated with obesity occur when the fat moves from the subcutaneous tissue to abdominal cavity. And so that is the context under which we now have to understand obesity, right? That is the molecular understanding of what it is.
Many years ago, men were the hunting prey approach to gather their meals. Now, with the restaurants and the quick availability of food, we don't have to exercise to get our meals. So you find that kids, the choice of meals make a big difference. People can have meals of high fat content, high carbohydrate content much more easier. And so it transforms into stored fat because of the high carbohydrate content. And so your choice of meals is a big thing. And the easy access to foods that are not appropriate to maintain a slim body mass.
So you say farmers will... Okay, go ahead.
Sedentary lifestyle. We walk to church, we walk to school. Now we're driving to go everywhere. And then we're sitting on the computer. You know, you're playing football on the computer. Kids are playing games, computer games, instead of going out there and playing a game of hockey or table tennis. So all of these factors.
They're saying exercise is key to prevent all these diseases. Stay tuned there. Let me just do a commercial here. Folks, don't go any place. Now, All for One supplier located in Queens, New York. You can get your West Indian foods there and groceries. You can get your roti, you can get your fish, you can get your meat. You can use your credit card, your debit card, your EBT cards. Any one of the cards you can use. And it will be delivered directly to your home. Just place your order, go to the website, All for One supplier. One is the number one, supplier.com. And you can place your order and it will be delivered to you at your home. Anything you want to order. The number is 718-551-3292. 718-551-3292. Globespan. For all your traveling needs, just call Globespan. They've been in business for over 30 years and they can book your tickets to any part of the world. They're also located in Queens. They have upcoming tours to Dubai, India, South Africa, Norway. Just give them a call at 718-845-0437. 718-845-0437. Or they have offices here in New York. They have offices in Rosalton and Val Park in Guyana and Chaguanas in Trinidad and Tobago. So give Globespan a call for all your booking needs. Thank you. Now, gentlemen, back to you. Now, there's something about weight. Is your weight depends on your height? Anyone?
Well, yes, if the total your fat content, your muscle content, your height. If you're tall, you will tend to your overall weight. But it's always useful that your your height should determine your overall weight and height. Should give you a BMI of less than 30. And less than 30, that is what is considered normal. But as I said, that no longer, very soon that will not be used to determine your body composition. If you're obese or if you're not obese, because your height and your weight, that's what was used to determine your body mass index. But as I would have described earlier, that fat, where the fat is, that is what is important, because we're looking strictly at inflammation, we're looking at risk for certain diseases, and so that is where I will look at it. I will not, look at height and weight. That is no longer a real indicator for obesity.
If a person is 6 feet tall, what do you think his average weight should be for him not to be obese or be fat?
Well, it's not, your, as I said, your weight and your height will determine your body mass index, and one is less than 30 is considered normal.
Okay.
So it's your body mass index that will determine if you're obese or not. It's a combination of your height and your weight. And that will determine, so the taller you are, the lower will be your body mass index.
The genetics play a big role in terms of height weight distribution. Some people, you can say, well, that guy is a rose. Generally, his father was short or tall or medium. So genes play a big role in terms of your body composition. But the weight is more an environmental thing. Even though genes play a big role in environment, as you, based on your location, your diet, and your exposure, and your cultural perception, you keep a certain weight. Access to food, the type of food, how nutritious it is, Some people go feel pretty comfortable looking with having excess weight because it's considered normal, especially in the Caribbean. Even in France, they prefer a slimmer body mass.
Dr. Cummings, you mentioned environmental issues that cause cancer. I got a question from one of our listeners. They asked me if you can outline what type of environmental issues or factors.
Well, pollution. The latest figures, information coming out from WHO. Of course, your diet and all of those are environmental, but pollution, CO2 emissions. Pollution is a major chemical. Through the smoke from exhaust. And that's why you see in industrialized cities, you go to in the blue zone in China and certain countries where there's not as much, certain environments that are not very industrialized. The air is healthier, and there's a reduced risk of lung cancer or other types of cancer. It's going back in the 18th century. The first carcinogens were actually isolated from smoke. So by inhalation, and so smoke, so the environment, from all these, the impurities from industrial waste from industries do contribute to cancer. But also, I also want to say that I must say this, that at the airports, going through that scanner, right? That radiation, which is an important aspect of cancer. You see what happened in Hiroshima way back, the dropping of that atomic bomb. It still have deleterious effects on the population, and so that's kind of being exposed to radiation, or computers or cell phones, all of these things, they emit, or microwaves. They all emit some amount of radiation and predispose us to cancer. And that's the major environmental factors that will contribute to cancer.
I want to chip in there, and because heart disease, as you know, is the leading cause of death in Guyana, and the top 4. And I want to emphasize for the listening audience, there are modifiable factors you can change, you can do to decrease your risk of dying early, and basically from stroke, heart attack, and sudden heart um, sudden death from heart-related problems. The things that you should go for your doctor and emphasize, and you can change, is your cholesterol, your blood sugar, and your blood pressure. The best index that you can really control is your blood pressure, which is a measure of your heart health. Your blood pressure is a major thing because the fourth leading cause of death in Guyana is hypertensive heart disease. So if you don't control the pressure, it's going to lead you to damage your blood vessels and damage your heart. And your, of course, your genetics, you not necessarily correlate that you will develop your grandparents' disease or grandmother or father. There's some people, parents have a disease, but they don't develop. But things you can change is your sugar content, your cholesterol, especially bad cholesterol, your weight and your activity. But one thing you will recognize, and I have physicians, I have a doctor who's a cardiologist who dropped dead last week. And you said he's a cardiologist, he should know better, but he still dropped dead at 65 years of age. Now, there's some population, the main culprit, what's the heart of the matter that leading to heart death is cholesterol, especially the bad cholesterol, LDL cholesterol. And there's subtypes, we can get more into details. But I want to emphasize this, is that you need to ask your doctor, and let me just go back here. So 80% is an 80-20 rule, and Dr. Rose is a professor of political science. You know about the Pareto's principle, but this is a flip of the Pareto's principle. 80% you can account for cholesterol, hypertension, sugar, lack of exercise, and family and smoking. But the 20% of people will have an heart attack, a brain attack, or a leg attack, and they have normal pressure, normal sugar, and normal cholesterol. So what are you talking about, Dr. Cummings? This guy looked healthy, he was exercising, he's slim, trim, and everything. That's where science haven't been able to answer, because there are 20% of people, they have other players that are causing them to have heart attacks and ischemic heart disease. And this has to do with novel discovery of other molecular stuff that Emmanuel mentioned. Particularly, there's a chemical, amino acid called homocysteine, that causes your, inside your blood vessel, we refer to your best measure of your probability of living longer is your intimal L, the inside of the blood vessel is the tunica intima. How good is this health? And this can cause your intima to become dysfunctional, utilize a lot of oxygen, and ask other blood factors such as platelet to come and start sticking up. And once you begin to stick up, they call other platelets and form a partial clot. The problem with people with coronary artery disease and plaque buildup is that they don't really have much symptoms. But when there's cementing of that plaque, there's opportunities for new plaque. These are, when these plaques are friable and easy break, then it breaks off and causes a brain attack and a heart attack. So it's a soft plaque that comes on top of the previous plaque, then the guy dropped dead because he always had coronary artery disease, but he had no symptoms or no brain problems. Is when the plaque is a new plaque that is friable. So if you want to go to your doctor to tune up, ask him to get your sugar tested. It's your fasting sugar that is important. It's supposed to be ideally less than 90, but not greater than 100. That means you're not going to eat anything from midnight, and your sugar supposed. If it's greater than 100, your body has to produce more insulin to keep the inflammation down, as Emmanuel mentioned. More inflammation in your blood vessels, the greater risk for the plaque that build up over time to rupture when new plaque builds up and cause you to have brain attack and heart attack and leg attack. So homocysteine is a culprit that accounts for the 20%, and there are multiple other biomarkers such as fibrinogen, lipoprotein, phospholipase, interleukins, but all of these fancy names, I can list more, so there are other things, But one thing that you must be aware that really come up with the 20%, and Emmanuel mentioned, is vitamin D. Vitamin D3 is a part of the player with those 20% of people who have normal weight, normal cholesterol, normal blood pressure, normal sugar. If you have a low vitamin D3, less than 32, you have increased risk of brain dysfunction, Alzheimer's disease, poor cognition, increased of heart disease, increased risk of inflammation in your blood vessels, increased risk of cancers, the colon, and skin disorders, and also dementia, and many other things. So you should make sure your vitamin D3 is optimal. And if it's not optimal, make steps to actually optimize that, usually over 3 months in measure. The one last thing I want to say, if the leading cause of death is ischemic heart disease, where plaque build up in your blood vessel, and you end up with little soft plaque on top of the plaque that breaks out and give you a heart attack or brain attack or leg attack, what single thing I can do? You have to ask your doctor not only to check your sugar, blood pressure, and cholesterol, you need to ask him to check your thyroid. If you want to go for tune-up, then check your thyroid, because thyroid influences your health. More stressed you are, more your thyroid will be hyperfunctioning. So thyroid health is very important. The next thing you're going to ask for is to make sure your hemoglobin, which is if you don't have blood in the tank, your heart won't function. But one last thing, which may not be available, is a marker of inflammation, is something called it's a marker of inflammation. It's called C-reactive protein. C-reactive protein, if it's greater than 1, preferably greater than 3, is a nasty marker of inflammation. And your doctor may not have it, but if you're sick, don't measure it. If you're not sick and you want to see where you are in terms of the amount of inflammation that's going, the C-reactive protein should not be greater than 1. If you're normal, if you're so-called healthy. So measure these things can be important. And one drug you should never be out. I'm not a guy that push pharmaceuticals, because not all drugs are helpful. They can make you worse. But where they're indicated, you need to use them. One single drug that can prevent you from dying abruptly or prematurely is aspirin. Since the theory is you have plaque buildup and then soft plaque comes on top of the hard plaque that cement over years and breaks off and cause you to have heart attack, brain attack, and leg attack, you lose your limb. Taking 2 to 3 aspirin if you have a chest pain can dramatically improve your chance of survival before you go to the emergency room. I've seen doctors who are cardiologists die and become paralyzed, partially function, because they did not aspirin. So a guy having chest pain in Oriala and trying to get to the hospital in Skeldon or anywhere in the Caribbean, if he just have 3 aspirin crushed in and put, it can change his outcome of survival or preventing from being paralyzed or being brain dead. So baby aspirin 81 milligrams is my best bet for any drug apart from as omega-3 and other elements that prevent inflammation.
Baby aspirins, you said?
Yeah, 81 milligrams. And
I can also extend on what Dr. Keith would have just said. Of course, aspirin is critical. Always ensure that you have aspirin at your hand reach, but also to emphasize the importance of homocysteine, which is an independent risk factor. You know, the so-called blood lipids can be normal, and you think everything is fine, but your homocysteine, that's the thing. You know, this was only discovered in the 1960s at Harvard by Professor Macaulay. And they're calling it the new cholesterol, but indeed your homocysteine. But I also want to add also what Dr. Keith would have also said there, is that you're keeping your legs have most of the blood vessels are located in your legs. And so always walk, exercise, keep your feet active as possible. And some early signs of cardiovascular disorders are numbness or pain in the legs. Might have nothing to do with chest pains, but pain in your legs. And so one way of preventing that is to always exercise, always keep your feet, on the, active.
That's a good point, Emmanuel. The other thing people should be aware, in a female, the definition or presentation of heart attack is different. There's a whole textbook written about chest pain equivalent to heart attack in female. A female, and this is many doctors have shared with me and around the world, Guyana including, where they have misdiagnosed a heart attack. A woman comes in with bad feelings is a heart attack for a female. A woman comes in with pain in the chin or jaw or ears or shoulder blade is a heart attack for a female. A man, the textbook is written for a man is chest pain, an elephant sitting on a pin. But the most common symptom for a woman is bad feeling and a chest pressure and not pain. So a woman pain for heart attack is different. Very important. I know people complain they lose patients like that, especially in a rural part of Guyana, right? And especially patients who cannot articulate their symptoms very well. They die because they think the wind pain or the indigestion or so-called stomach discomfort as just another gas or bad feelings.
I just
And
got a
also,
message. Okay, go
and
ahead.
also, doctor, if I can just add, you see, your circulatory system is, it's so important. Your cardiovascular health is also poor cardiovascular health can be a risk factor for cancer, for prostate cancer, right? Because irrigation of the prostate gland is important. And so instead of being properly irrigated, there is deposit of calcium and predispose you to prostate cancer. So all of these things are interrelated. Cardiovascular, obesity, cancer, they're all one can cause another. They can cause each other, they can be a risk factor for one another. And so overall health, exercise, diet is critical too. If you can prevent obesity, you can reduce the risk of diabetes. You reduce the risk of diabetes, you reduce the risk of cardiovascular disease. Reduce the risk of cardiovascular disease, reduce the risk of cancer. So they're all interrelated.
Listeners sent me this message. Dr. Rose, you have two very well experienced and educated doctors in your program. But can they come to Guyana and practice there? Because we're dying down here. They should leave New York. Let me say to the listener, Dr. Emmanuel Cummings is in Guyana. Dr. Emmanuel Cummings, you don't practice privately.
No. I'm a professor. I teach the doctors. I teach them to do the right thing.
Well, I'm telling this list, and it's a she, that Dr. Emmanuel Cummings is in Guyana. So
always in Guyana.
He teaches doctors. So
and
maybe
Dr. Keith, even though he's in the US, he teaches in a medical school also in Guyana as well. And he visits here quite often.
So, but it's
so
come to practice to save them, because they're telling me that doctors in Guyana are no good.
So what to do there?
That's a broad.
A broad statement.
Yeah, that's a broad brush claiming all
doctors.
So
we don't want to get involved in that part of the discussion.
Yeah.
No, not me.
But we can help them. We can help them to arm them with knowledge and opportunities to articulate on their behalf. And so one of the things what have to be done is to change the policies in terms of the healthcare system is operating in Guyana. So patients have more right to advocate for themselves. And so they can arm themselves with the opportunity to make sure that the leading cause of death don't become one of those that stop to the door by advocating for better blood pressure control, which is a direct measure of your health, cardiac health. Get your blood pressure preferably less than 180, 130, 80, ideally is 120, 80. If your blood pressure is greater than 140, 90, it's a bad sign. Get it down by non-pharmacological, non-drug means first. Means you're going to cut your weight, get active, cut your sugar, cut your cholesterol down, and eat food that are rich. Your plate should look colorful in simple language. Get greens and vegetables, more nuts and grains. Avoid the heavy starch and fatty foods, and advocate for your family to do so. When you go to the doctor, get a book with a pen and write down some of the questions before you go to the doctor and ask him to measure your cholesterol, your sugar, and pressure there. And you also keep measuring your pressure at home. Because the best measure of your cardiac health is your blood pressure. Because your blood pressure is a product of your heart function. How your heart is pumping is the top number, and the relaxation is the bottom. If your heart is pumping and the pressure is very high, if it's pumping above 140, it means your blood vessels are not relaxing. If you have a pump pumping water from one region of Guyana to the next, and the pump is backing up and backfiring, it means that there's obstruction. So the heart has to pump more harder, the pressure raises. Then when it's relaxing between beats, it's the low number, the diastolic pressure. The top number is systolic, bottom is diastolic. It has to relax. If the heart is relaxing and the pressure is high, something is wrong. The heart is too stiff. So you can optimize that by changing your lifestyle. Cut your salt down, cut your fat down, exercise more, at least 3 times, preferably 5 times, and stress. One of the things we emphasize is cardiac function based on how blocked the vessels is, which is true, and your brain function, etc. But if you have too much stress, it will cause a wiring of your heart to trip, and those lead to a different type of heart disease we call arrhythmias, where the rhythm is out sync, and some people end up with clots. And that's the number one reason for stroke, is because not only hypertension leads the heart to be bigger and dysfunctional, but the irregular rhythm causes your blood to stay too long in the heart chambers, and whenever the heart comes back to normal function, it pushes clot in your brain and leads to stroke. So again, because the arteries are the one that form the clot, the best medication you can have is aspirin. I've known people personally who could have lived by simply having 3 aspirin crushed and put in the mouth of their family members. If the aspirin is a blood thinner, antiplatelet, because the first clot that is formed in your body is formed because the platelet has to call other platelets and form a clot. So if you get something to prevent clot from forming, that is the best. Even though you show up in emergency, you know what the best thing to do? They give you aspirin. So why can't you take it before you reach to the ambulance or reach to the emergency room? You will save your life fundamentally. You'll save being disabled, being bedridden. I'm telling you, I've known of many doctors who died. I'm not talking about regular people, and that's what I'm emphasizing. Heart doctors who end up with stroke, end up with heart attack, and died because they failed to use aspirin. So you can help yourself and help your family by doing so.
There's a specific question for you all, both of you all here. There's a lady, she said her name Doris, says she's 54 years old. And said her blood pressure is been 135 upon 88. And said it's been like this for the past year. Says the doctor told her she must exercise. Says she runs and walks 2 miles every day. She cut back on her diet, not eating as much meat. She eats a lot of fruits and vegetables. She says, but it's not going down. What's the answer?
135, 85 or 80 is perfect.
135 upon 88.
Perfect. I will congratulate her. Don't try to lower it. If you're less than 60, you're supposed to be less than 140, 90. Ours is below that. If she's greater than 60, it's supposed to be less than 150, 90 if you have hypertension. So if you don't have hypertension, ideally is 120, 80, preferably less than 130, 80. If you have hypertension, you're targeting to less than 140, 90. You're targeting to less than 150, 90. If you're greater than 60, less than 60, 140, 90. So your target, you show up with disease. Your body is not in ease. You're targeting. That's a different situation versus you don't have disease. So she's in good state. Don't try to reduce it more unless you have advanced heart disease 138 is ideal, unless if you have advanced heart disease. For most part, there is no need to drop the blood pressure more.
Okay. The other question, another person
But I just
asked me.
wanted to
Go ahead. Go ahead.
just explain. Your your blood pressure, high blood pressure, cholesterol, and I think we spoke earlier about cholesterol, and and cholesterol is not a problem. Cholesterol becomes a problem depending on the type of fats you include in your diet. Saturated fats that you get from meat, poultry, that is bad for your cholesterol. That is what precipitates bad cholesterol. And so, to keep your cholesterol levels normal, try to consume fats, healthy fats. You get from avocado, from olive oil, from sardines, from fish, salmon, fats. Those fats will keep your cholesterol. And the longer you can keep your cholesterol healthy, the better it will be for your blood pressure.
So let me help the audience with some cholesterol numbers as well. That's a good point. People want to know what's normal. You have different types of cholesterol. Your total cholesterol is supposed to be less than 200. If it's going above 200 to less than to 239, you're getting a little dangerous there. Average in America is 130. You want to get it below 200, right? There's another cholesterol, the bad cholesterol, as Emmanuel mentioned. We call it LDL cholesterol. You want to get that less than 90 ideally. 100 is average, 130s. If you go into 160s is bad. 90 definitely, 190s you may need treatment. Above 200, that's bad. And then you have triglycerides. 150s and above is bad. And then the good cholesterol, HDL cholesterol. For man, you're supposed to have the good cholesterol, HDL, greater than 40, and for female, greater than 50. Now, these are individual cholesterol, and then there's a lipoprotein A, which is the bad cholesterol. The good thing you should do is don't wait on your doctor. Take your total cholesterol and minus your good cholesterol, HDL cholesterol. So put total cholesterol over the HDL cholesterol, the good one, and divide it. So if the number is low, 3.5 to 3 is great. If the number is higher, get into 4, 5, 6, that's a bad. So to make it easy for you, take your total cholesterol and divide it by the HDL, which is called the good cholesterol. Numbers 3.5 to 3 and less are great, but higher numbers are bad.
So where 200 comes in? It said 200?
It's for the total cholesterol. So there's several cholesterols. There's a big family, and everybody bunch up together. If it's greater, the number greater than 200 and going on to 300 is getting bad. And under that umbrella total, they have HDL cholesterol, LDL cholesterol, and triglycerides. So these other subheadings have their individual numbers. But the other thing that people should be aware of, and people ask, oh yes, my cousin was slim, his cholesterol was good. As I told you, there are even subheadings under these LDL cholesterol and good cholesterol. So that's why, and as I spoke, that about 20% of people, everything looks perfect. The basic things look perfect, and still they have a heart attack because there are other biomolecules, homocysteine, fibrinogen, interleukins, and all these things. And particularly, as I mentioned, the one that you can control to minimize the inflammation, the driver of intimal dysfunction inside the blood vessel, the layer inside, the innermost layer, dysfunction is inflammation. So these biomolecules like homocysteine, interleukins, and lack of vitamin drive inflammation. And so if you can control the amount of vitamin D, so when you go to the doctor, ask him about vitamin D level. So at least every 6 months or minimum once a year, you should take your vitamin D level, get your thyroid function, get your cholesterol, sugar, blood pressure as a thyroid function. Those are things you should write down in a book and make sure those things are measured. And one other thing I must mention may not be available. If you measure the carotid vessel, the blood vessel from the heart to the brain, if you measure how thick, we call the intimal medial thickness. If you measure how thick that layer is, it's a measure of your brain blood vessel, your heart blood vessel in the leg. So it's an overall measure. So by Not, there's a test called a Doppler flow that just measures flow of blood to your brain, but this one is the thickness itself that kind of extrapolate and tell you how good your heart. So you don't need to go in the heart or go in the leg or go in the brain. You can measure the thickness of the wall of the blood vessel, the carotid blood vessel in the neck, and it's a good measure and extrapolation that 90% of the time, if there is thickness is thicker than normal and this degree of thickness, it correlates pretty well in your brain health, heart health, and leg health, and the degree of plaque burden. And again, plaque is laying down a bad cholesterol over a period of time, which doesn't cause much symptom unless you can exercise. You get shown the breast, they do cardiac stress testing, and then they see that you have a problem. But more, the problem again is plaque laid down, and new plaque, which are soft plaque that comes in on the cemented plaque and breaks off. That is what leads you to heart attack, not old plaques that lay down all the time. Is new, we call them soft plaques that are unstable. It's like pimples. You only have a lot of blackheads. Now the new pimples that burst, that is what causes you to have an infection to your brain and end up with meningitis, like the heart disease and brain attack. The new soft plaque is what's going to lead you to heart. So the good thing is to get the aspirin and take it immediately.
And that's baby's aspirin.
I just wanted to add before you close, I notice time is going.
Yeah.
Very important that women after menopause are at risk, right? For your HDL usually drops, HDL, which is your good cholesterol. And also, lots of person take, there's a calcium, magnesium, and zinc with vitamin D3. Spoke a lot about vitamin D3, but usually you should take that with vitamin K, because calcium, which is good for contraction of the heart, muscles, bone health, and everything else, vitamin D. But studies are now showing that you should take your calcium with vitamin K. Without vitamin K, the calcium goes to the prostate and cause prostate cancer. The calcium goes to the arteries and cause arteriosclerosis, which results in high blood pressure. And so when you take it with vitamin K, it's more likely to go to the bones where it's supposed to go. So a combination of these micronutrients are so important, right? So the real point there is take your calcium with vitamin K2, which helps to store it in the bones and not in the walls of the arteries, which predisposes you to high cholesterol and cardiovascular disorders.
But we're coming to the end of the program. But Dr. Keith Cummings, a lady asked me to repeat, if you could repeat, what are the signs of stroke for women? You said the signs of stroke for women.
So the stroke for women and men may be the same, but the heart attack is different.
Well, heart attack then. The heart attack she meant.
So the heart attack for women, look for chest pressure, not pain. If you have pain, it means you really have heart attack. There are many causes of pain in the chest, but if your woman has a heart attack, look for indigestion, bad feelings that is not going away despite your resting. And also, if you take, some people have underlying coronary artery disease already, they take medication to relax the blood vessel. If it persists, it's heart attack for women. Secondly, they have pain in the cheek or the jaw, pain radiating to the back, or shoulder blades, pain to the arm. But man is pain, real pain. A woman is pressure, discomfort in the stomach, discomfort in the arm and the jaw. So you don't take it for granted. The longer you take it for granted, the more you're losing muscle. And muscle is time. So you have a little heart attack or big heart attack. Little heart attack leaves scars in the heart, and you never knew you had an heart attack until subsequent follow-up. And that leads to weakening of the muscle of the heart and increase the risk of the heart going irregular. Because these scars are like scars in the skin. The muscle of the heart doesn't repair itself well. And so it leaves scars and increase the risk of irregular heart rhythm, which we call arrhythmia. So women are easier to die because additionally, as you get older, your symptoms of heart attack changes. And another thing is diabetes. Diabetes literally damages the nerves of your heart. So you don't even feel you have chest pain in a diabetic patient. You can imagine a patient has Alzheimer's disease, elderly, living in a home by themselves, and has indigestion, and the nerves become damaged because of diabetes. They have no pain, and they have a heart attack. They just have bad feelings.
Okay, hold that thought. We come to the end of the program. Dr. Emmanuel Cummings, I'll ask you for your closing remarks.
Well, I was with cancer. I think the suggestion here is early detection. The early detection, genetic testing. I think that's where we should go. Or early diagnosis. Early diagnosis. There's greater chance of survival. Um, Outside of the 5 years, exercise, vegetables, green, yellow, purple vegetables, healthy diet. I think that is what I would want to leave the public with as a means of reducing the risk. And I think it will not only prevent you from developing cancer, but it also cardiovascular disorders, healthy fruits and vegetables, and exercise. And don't eat at night. Don't. Your last meal should be at least 4 hours before you go to bed. At least 4 hours. Your last meal. Okay.
Dr. Keith?
So the leading cause of death in the Guyana is cardiovascular disease, particularly ischemic heart disease, where there's insufficient blood going to the heart muscle because the blood vessels full of plaque. You can change your outcome by changing your sugar level, control your sugar, control your cholesterol, especially bad cholesterol, control the amount of alcohol you take, smoking cessation, get active, reduce weight, and ask yourself genetically where you're from. Do you have family members who are propensity to have these disease? And if that is so, check where you are, advocate for your doctor to get your thyroid check, your cholesterol, your blood pressure, which is a major thing you should control and measure and record. Get a little calendar, write down your blood pressure so you can take it to your doctor. You have to be an advocate for yourself. Check your blood pressure at home and also your hemoglobin. And always get a bottle of aspirin in your house, maybe your car, baby aspirin that is. And if you have a severe chest pain or indigestion or pressure as a female, take at least 2 to 3 aspirin, chew them up, and it will significantly reduce your chance for being dead or come out of the hospital paralyzed or partially impaired.
Thank you all very much, gentlemen. You all are very, very good. I will have to bring you all back. But thanks to Noir Singh for making this program available, and to Devin Bissoon and Ryan Gobin, our 2 technical directors. And also thanks to our listeners, and more specifically, thanks to all our sponsors. Because without you, this program would not have been available at no time at all. So thanks to all of you. And one final word. I'm asking you all to please purchase my book. It's called A Race to the Finish Line. The election of Barack Hussein Obama as the fourth Black president of the United States. It's a very good read, excellent reviews on it. So, and it's only cost $39.99, a soft paperback. But the hard copy coming out sometime in late November, and that will cost over $200. So I'm asking you all to get it now and get it early. Thanks again to Dr. Emmanuel Cummings, and to Dr. Keith Cummings. Thank you all very much for coming on. But I will have to bring you all back, because having a health program on this channel is very, very good for the people in not only in Guyana, but around the world, because we broadcast around the world. So I think it's very, very educational. And a lot of people took notes based on the questions they were asking me, but I could not even go out. I got 57 questions and only asked you all about 10. So the people were listening, and they were very, very much concerned. So thanks a lot again. But I'll bring both of you back on, because you guys are really good. I'm elated with your presentation here tonight. Thanks again, and good.